I'm Dr. Robert Drummond, and today we're going to talk about the Norwood Scale. What it is, what it isn't, and the part that actually matters. Patients love asking, Doc, what Norwood am I? And I get it. Humans like labels. Labels feel like clarity. But the Norwood number is not your destiny. It's a snapshot, a still photo. And your hair and its hair loss is a movie. The Norwood Scale is a classification system for male pattern hair loss. It ranges from early recession at the temples to more advanced patterns involving the crown and mid-scalp. It's useful because it gives us a common language. If I say Norwood 3, another hair surgeon has a rough picture in their mind. But the Norwood number alone does not tell me what I need to know to plan a great long-term result. Here's what I actually care about. Pattern. Is it mainly hairline? Mainly crown? Diffuse thinning? Pace. Is this stable or moving quickly? Donor. Do you have enough high-quality donor supply for what you want? Family history. Where does this typically go in men like you? 2 men can be Norwood 3 today. One will stay at Norwood 3 for 10 years. The other will be a Norwood 6 by 35. Same number today, completely different strategy. So when you hear someone online say, I'm a Norwood 3, how many grafts do I need? I want you to understand why that's not a real question. It's like asking, I'm hungry, how many calories do I need? It depends. What's the goal? What's the timeline? What's the baseline? Now, let's walk through what Norwood stages usually mean. In practical terms, early stages, you're seeing temple recession. Often the hairline is still fairly intact, but the corners are starting to creep back a little bit. The most common mistake here is overreacting and trying to restore a teenage hairline. That looks great in a filter, but terrible in real life, especially as you age. Mid stages, you start seeing the crown open up or the mid-scalp thin. This is where the illusion of density becomes a real topic. You can't just fill everything in. We're managing coverage. We're framing the face. We're prioritizing. Advanced stages. The donor to recipient math becomes harsh. It's not about skill anymore. It's about supply. If the bald area is large and the donor supply is limited, you're choosing where the hair goes to maximize the look. This is where my philosophy is simple. I would rather give you a result that looks natural and intentional than chase density and promises that can't be delivered safely. And I'm going to say this with love. If someone promises you full density everywhere in one session, they are either inexperienced or selling a fantasy. Usually both. So what should you do with Norwood number? Use it as a starting point, not a plan. Here's the what actually matters checklist I give patients. 1, are you stable? If not, stabilization comes first. 2, what hairstyle do you want long term? That changes priorities. 3, what is your donor capacity? That's the budget. And 4, what is the minimal result that makes you feel like you again? That's the target. If you're watching this and you feel like you're constantly trying to guess your stage, you're not alone. But guessing isn't the move. Evaluating is the move. And here's the fun part. Once you understand your stage and your trajectory, hair restoration stops being a mystery and starts being a plan. If you want that plan, call us and book a consultation. And if you learn something, comment crown. It helps the algorithm, and it helps me know you want more of this educational content.